So today we're going to discuss activity and exercise. Exercise is physical activity for the purpose of conditioning the body, improving health, and maintaining fitness. It also is a therapeutic measure. A program of regular physical activity and exercise has the potential to enhance all aspects of a patient's psychosocial, and spiritual model of health. The actions of walking, turning, and carrying are all common nursing activities that require the use of muscles. To reduce the risk of injury, nurses need to comprehend and practice proper body mechanics and remain knowledgeable of current research standards and guidelines concerning safe transfer and position techniques. Coordinated efforts of the musculoskeletal and nervous system maintain balance, posture, and body alignment during lifting, bending, moving, and performing activities of daily living. The ability to engage in normal physical activity and exercise depends on intact and functioning nervous and musculoskeletal systems. Correct alignment involves positioning so no excessive strain is placed on a person's joints, tendons, ligaments, or muscles, thereby maintaining adequate muscle tone and contributing to balance. Body mechanics consist of the coordinated efforts of the musculoskeletal and nervous system as a person moves, lifts, bends, stands, sits, lies down, and completes activities of daily living. Coordinated body movement requires integrated functioning of the skeletal system, skeletal muscles, and nervous system. Remember, when moving or positioning a patient, you must keep all of these concepts in mind. If you do not practice proper body mechanics and principles, both the patient and the nurse can be injured. To reduce friction, you need to decrease the object's surface area. Physiologic, emotional, and developmental factors influence the patient's activity tolerance. The best program of physical activity includes a combination of exercise that produces different physiologic and psychological benefits. Isotonic exercises cause muscle contractions and change in muscle length. Examples are walking, swimming, dance, aerobics, jogging, bicycling, and moving arms and legs with light resistance. Isotonic exercises enhance circulatory and respiratory functioning, increase muscle mass, tone, and strength, and promote osteobalance activity, preventing osteoporosis. Isometric exercises involve tightening or tensing muscles without moving body parts. In some long-term care settings, footboards are placed at the ends of beds, and patients push up against them to move up in bed. The skeletal system provides support, protection, movement, mineral storage, and blood cell formation. Joints are the connections between bones. Fibrous joints fit closely together and are fixed. Cartilaginous joints have little movement but are elastic and use cartilage to unite separate body surfaces. Synovial joints, or true joints, such as the hinge type at the elbow, are freely movable and are the most mobile. Ligaments bind joints and connect bones and cartilage. Tendons connect muscles to bones. Cartilage is non-vascular supportive tissue that acts as a shock absorber between articulating bones. Skeletal muscles determine body form and contour. Muscles of movement are located near the skeletal region, where a lever system causes movement. Muscles concerned with posture are activated as gravity continually pulls on parts of the body. Coordination and regulation of muscle groups by the nervous system depend on muscle tone and activity of antagonistic, synergistic, and anti-gravity muscles. Muscles are responsible for maintaining posture and movement, and the nervous system regulates movement and posture. Proprioception is awareness of the position of the body and its parts, and balance is controlled by the cerebellum and inner ear. Factors influencing activity and progressing into exercise. Looking at the newborn infant, the spine is flexed and lacks the anterior-posterior curves of the adult. The first spinal curve occurs when the infant extends the neck from the prone position. The toddler's posture is awkward because of the slight sway back and protruding abdomen. As the child walks, the legs and feet are usually far apart and the feet are slightly everted. By the third year, the body is slimmer, taller, and better balanced. The period of adolescence usually begins with a tremendous growth spurt. The healthy adult has the necessary musculoskeletal development and coordination to carry out activities of daily living. As patients age, a progressive loss of total bone mass does occur. Body balance becomes unstable, and older adults are at a greater risk for falls and injuries. Patients are more likely to incorporate an exercise program into their daily lives if supported by family, friends, nurses, healthcare providers, and other members of the healthcare team. When looking at factors influencing activity, a common barrier for many patients is the lack of time needed to engage in daily exercise program. Children today are less active, resulting in an increase in childhood obesity, and schools are excellent facilitators of physical fitness and exercise. Community support of physical fitness is instrumental in promoting the health of its members. For example, providing walking trails and track facilities in parks and physical fitness classes can help support the community. When developing a physical fitness program for culturally diverse populations, consider what motivates them and what they see as appropriate and enjoyable. Social support is one motivational tool used to encourage and promote exercise and physical fitness. Companionship provides for socialization, increased enjoyment, and develops a lifelong commitment to physical fitness. During assessment, you will want to gather information regarding the patient's ability to stand, sit, lie down, as well as regarding the degree of mobility, range of motion, gait, ability to exercise, and activity tolerance. You also want to review patient's medical history and current health status. When planning goals and outcomes, you will tailor the plan of care to the patient's specific needs. Implementation of therapy services and coordination of health promotion, continuing care, or restoration of activity. Health promotion may focus on body mechanics, range of motion, maintenance of the musculoskeletal system, joint mobility, and walking. Incorporating the use of assistive devices for walking, such as canes or crutches, and improving activity and coping with chronic illnesses may require that you specifically address issues surrounding activity and the patient's specific health history. As the nurse, you will always evaluate whether the patient has met goals, outcomes, and adjust interventions as needed. When assessing standing, the correct body alignment when standing consists of the following. The head is erect in midline, body parts are symmetrical, the spine is straight with normal curvature, abdomen is comfortably tucked, knees are in straight line between the hips and ankles and are slightly flexed, feet are flat on the floor and are pointed directly forward and slightly apart to maintain a wide base of support. Arms hang comfortably at the sides. Patient's center of gravity is at the midline, and the line of gravity runs from the middle of the forehead to a midpoint between the feet. You can see this in the illustration. Laterally, the line of gravity runs vertically from the middle of the skull to the posterior third of the foot. To better understand activity tolerance, physical fitness, and their effects on the patient, it's important to integrate knowledge from nursing and other disciplines and from previous experiences, as well as information gathered when assessing the patient. So in this slide, we actually have reviewed previously standing, so now you're looking at the sitting assessment. With the sitting assessment, the nurse is assessing that the head is erect, the neck and vertebral column are in straight alignment, body weight is distributed on the buttocks and thighs are parallel and horizontal, feet are supported on the floor, and forearms are supported on the armrest, in the lap, or on a table in front of the chair. This is important for the patient with muscle weakness, muscle paralysis, or nerve damage. This next slide, we're going to be looking at bed mobility. When assessing the patient in the recumbent position, you place the patient in the lateral position, removing all positioning supports and all but one pillow. Assess the patient's ability to roll side to side, scoot up in bed, and ability to get to the edge of the bed. Assessment of mobility helps to determine the patient's coordination and balance while walking, and ability to carry out activities of daily living. The assessment of mobility has three components: range of motion, gait, and exercise. By measuring the range of motion of a joint, you're able to answer questions about joint stiffness, swelling, pain, limited movement, and unequal movement for possible limitations of range of motion. Gait is the manner of style of walking, including rhythm and speed. Exercise conditions of the body improve health, maintain fitness, and provide therapy for correcting a deformity or restoring the overall body to a maximal state of health. It is especially important to have knowledge of the patient's home environment when planning care to maintain or improve activity, body alignment, and mobility. Also include the patient's family in the care plan. For patients with limited range of motion or mobility, the nursing care plan needs to include interventions that maintain the present level of alignment and joint mobility and increase the level of motor function. Be vigilant in monitoring the patient and supervising assistive personnel and carrying out activities to prevent complications of potential injury. Before starting an exercise program, teach patients to calculate their maximum heart rate by subtracting their current age in years from 220, and then to obtain their target heart rate by taking 60 to 90% of the maximum, depending on their healthcare provider's recommendation. Resistance training increases muscle strength and endurance and is associated with improved performance of daily activities and avoidance of injury and disability. Before lifting, assess the weight to be lifted, determine the assistance needed, and evaluate available resources. It's important to use safe patient handling equipment when the patient is unable to assist in the transfer. Encourage patients who are hospitalized to do stretching and isometric exercises, active range of motion exercises, or low-intensity walking, depending on their condition. This will enhance their level of function and improve their outcomes. So in this picture, you see a controlled fall. If a patient begins to faint and fall, follow these steps to ensure that you both have a less traumatic fall. Stand with your feet apart to provide a broad base of support. And you see this in the first part of the picture. The next picture in B, you see how the attendant extends one leg and lets the patient slide against it to the floor. Notice also the nurse is putting one foot back. Then in the third picture, C, you can see that the knees were bent to lower the body as the patient slides to the floor. The importance of controlling a fall is to prevent injury to the patient and the nurse. So principles of transfer and positioning techniques. When moving a patient, knowledge of safe transfer and positioning is crucial. It's important to know about a patient's congenital defects, disorders of bones, joints, and muscles, central nervous system damage, or musculoskeletal trauma, because all of these conditions will affect how you move, transfer, or position a patient. You need to be aware of whether the patient can or cannot help you, and you need to prepare for assistance if the patient cannot help you. Teaching a patient's family to transfer the patient from bed to chair increases and reinforces the family's knowledge about proper transfer and position techniques. Congenital abnormalities affect the efficiency of the musculoskeletal system with regards to alignment, balance, and appearance. Osteogenesis imperfecta is an inherited disorder that affects bone. Bones are porous, short, bowed, and deformed. As a result, children experience curvature of the spine and shortness of stature. Scoliosis is a structural curvature of the spine associated with vertebral rotation. Muscle, ligaments, and other soft tissues become shortened. Balance and mobility are affected in proportion to the severity of abnormal spinal curvatures. And osteoporosis is well-known and well-publicized disorder of aging, which results in reduction of bone density or mass. The bone remains biochemically normal but has difficulty maintaining integrity and support. The cause is uncertain, and theories vary from hormonal imbalance to insufficient intake of various nutrients. Damage to any part of the central nervous system that regulates voluntary movement causes impaired body alignment and immobility. Musculoskeletal trauma often results in bruises, contusions, sprains, and fractures. So this will conclude the first part of this section.